Well, as instability in America continues, the medical sector is facing healthcare funding cuts, massive layoffs, and hiring freezes, leading to an increase in doctors who are now interested in moving to Canada.
Okay, so what could that mean for Ontario's healthcare system? Joining us live this morning, the president of the Ontario Medical Association, Dr. Dominik Nowak. Good morning again, Dr. Nowak. Glad to have you back in this morning. This is a really interesting situation because I remember back in the 90s, all the talk was about Canada's brain drain to the U.S. All of our doctors, nurses are being recruited out with big money, low taxes, better work, whatever. Now the reverse seems to be happening. How could that help Ontario's healthcare system?
And I'll start with why wouldn't people want to come to Ontario, to Canada? We're the greatest country in the world. And we have world-class doctors working out of world-class hospitals, doing world-class research and giving world-class patient care. We have something to be proud of here. For sure, we have our challenges. And that's why addressing our physician workforce shortage by bringing in international doctors can help solve some of those challenges.
So we all know about the doctor shortages, the wait times at ER rooms in Ontario right now. I mean, this has been happening kind of pre-pandemic and even got exacerbated after the pandemic. So what are the challenges in bringing in international doctors? Would it be easier to bring in an American doctor versus a doctor from a different country, let's say?
Yeah, look, we've worked on expedited pathways to get doctors in front of patients in Ontario, in Canada. That includes U.S.-trained doctors, so we have ways to get them in front of patients with the supports that they need. But keep in mind, it's not just about bringing in new doctors, it's about keeping the doctors that we already have in the system and making sure that they feel joy in work, making sure that they feel supported, making sure that we updated our funding models and get rid of that administrative burden and make Ontario the best place to practice medicine in the world.
It's interesting, you see some of the reporting on this earlier, talked about, highly advanced, medical specialists in very precise areas of medicine. But what we really need is family doctors, isn't it? It's really, like in Ontario, that's where the shortage seems to be. Do you understand the breakdown? Like, are there a lot of family doctors who want to come here, or are they special? I mean, we have incredible specialists already. Not that we wouldn't take them, but the real need is family doctors, is it not?
Well, it's both, right? If you look at how our healthcare system works, we need a family doctor for everybody, and that's what we're working on in Ontario. Right now, nearly one in four people can't find a family doctor. And at the same time, look, I'm a family doctor myself. I rely on our specialist colleagues to see patients. Right? And that's where we do have severe gaps in many parts of Ontario. I'm thinking of gaps in maternity care, obstetrics, gaps in psychiatry, gaps in surgery, in cancer care, all these different types of things. And that's where it's about family doctors and specialists and all of us working together to get our healthcare system back on track.
And, just citing some of the things that have happened since U.S. President Donald Trump took office, there's been massive changes to kind of their healthcare system, CDC cutting 2,400 jobs, even with women's rights kind of on the decline there with, abortion being off the table for many states. So when you talk about U.S. doctors moving here, what would kind of be the hurdle for them coming here? Would it be the pay difference because of our Canadian dollar? And what would it take to get them here right away?
A lot of what we're seeing are things like outdated funding models, that 19 hours weekly of administrative burden, the red tape that we have in our system that's preventing doctors just from being doctors. That's what we train to do. And at the same time, we're hearing from docs that there are good reasons to practice in Canada, good reasons to practice in Ontario. Healthcare is our economic advantage. And to have a strong Canada, we need to have a strong healthcare system, and this is our window of opportunity to build that and make it even stronger, especially at this time of turbulence in the world.
All right, let's hope we can capitalize on that. Dr. Nowak, really appreciate the time as always. Thanks for being here.
Pleasure to be here.
Thank you, Doctor.